A simple lab test that predicts how fast you are aging. Wouldn't that be wonderful? Today we're going to dive into this powerful topic. We're going to look at this marker of health and aging that is often overlooked. It tells you how you're aging internally. It may be the most important lab test to have done if you can only have one lab test done. And here's why. High levels on this lab test predict dementia 25 years before you get dementia. Cancer. Your defense system or immune system has a self-destruct mechanism that stops cancer cells from multiplying. Your defense system can be blocked by high levels of this lab test. And then cancer progresses. Heart disease is caused by high levels. Even pain is associated with high levels of this test. So which test is it? Is it blood sugar, cholesterol? Is it gene testing? Is it vitamin D? Is it insulin? Well, it's not any of those, although they're all good tests. And here's the truth, most doctors miss this test. They don't do it. They assume that they want to focus on cholesterol or glucose as the keys, but those are lagging indicators. We already have a problem if those numbers have been running high. The test that I encourage you to check out is called high sensitivity C-reactive protein. It gives you a good indication of future risk, what's going on in your body. Cholesterol and blood sugar get the spotlight, but they often indicate damage that's already been done. HSCRP is an early warning sign. What's brewing, what's going to be happening. HSCRP is the ideal marker for indicating the level of inflammation in your body. And as Time magazine pointed out a couple decades ago, I believe, the secret killer, the surprising link between inflammation, heart attacks, cancer, Alzheimer's, and other diseases. Inflammation has been called inflammaging. If you have inflammation, you are aging faster than you should. So the liver produces CRP when your body has inflammation going on. It is linked to oxidative stress, telomere shortening, and what that means is you're going to die sooner, and mitochondrial damage. And the mitochondria are your energies that produce power in your body, produce energy. If they're malfunctioning, it can lead to all kinds of chronic disease. And we know that lower inflammation equals slower aging, and that's what we want. Now I want to clarify that there are two tests you may be presented with. CRP, now that's like a flashlight. It's a big spotlight, and it doesn't pick up the little things. HSCRP is like a magnifying glass. It shows you, all right, you got low-grade inflammation going on and the level of it. So why is inflammation aging you? Inflammation is known as the silent engine of aging. So if your aging engine is pushed to the floor, your throttle, and it's revved up all the way, that's what inflammation does, and we don't want that. We want that motor to be idling slowly. It fuels heart disease, cancer, Alzheimer's, and many other diseases, as I've mentioned, and it signals your body that you have an internal fire going on. It's kind of like a fire alarm that tells you you have a problem. So what are normal levels? Ideally, your test should come back below 1, and that's what my test shows. 1 to 3, moderate risk, that's a warning sign, and if you get above 3, you have a significant problem that needs to be addressed. Why is this test overlooked so frequently? It doesn't diagnose a disease. It just tells you you have inflammation going on. Also, insurance companies frequently do not cover this test. And many doctors prioritize urgent things rather than important things. Modern medicine tends to ignore these early warning signs, these whispers. They wait for a crisis to happen and then get involved then. So what my patients taught me after doing hundreds and hundreds of these tests, healthy looking patients can be inflamed. So you can't judge inflammation just by the appearance. Now if it's very severe, it does have indications physically, but not until things get down the road too far. The root causes are often hidden. Many lifestyle factors can either raise or lower CRP depending upon what you're doing. So what are the biggest causes of this hs-CRP being elevated? Obesity. Your fat cells send out inflammatory signals to your body. Leaky gut, absolutely connected with inflammation. Dysbiosis, or having the wrong bacteria in your intestinal tract. A poor diet, and diet is huge. You have to have the right diet. When we have too many processed food and too many seed oils coming in, those seed oils are inflammatory. Stress or poor sleep, autoimmune disease, and toxins. All of these things are factors in inflammation being significant in your body. And if you look at those things, it's kind of an overlap of the systems of your body. Any system in your body, any of the 7 main systems in your body, if they're malfunctioning, can lead to inflammation. Now, by far the most important system to keep in mind is the defense system, your immune system. But every system can contribute. And we need all of these systems to be working correctly, or you won't have ideal health and longevity. The defense system's a little different than the other systems. It has to be balanced. If it's under-functioning, you get sick a lot. If it's over-functioning, then you can develop allergies, asthma, autoimmune disease, and inflammation. Inflammation is frequently an overactive defense system. So what makes that system overactive? If you've been following me, you know your defense system has several key parts: your tonsils, your lymph nodes, your bone marrow, but most significantly, your gut lymph tissue. 70 to 80% of your entire defense system, immune system, is surrounding your intestinal tract. There's that gut lymph tissue. Now that's important because it's a good place to have your defense system with all the food and bacteria coming in. But if you have a leaky gut, as most Americans do, gaps between the cells, there's that gut lymph tissue, here's your bloodstream, here's the intestinal tract, and food that's not digested and bacteria can get in here and activate that gut lymph tissue, and that sends out these inflammatory signals throughout your body, affecting your skin, your organs, your bones, your joints, and leading to autoimmune disease. So we need to heal the gut, get those tight junctions back so that the food has to be broken down correctly to get in, and the actual bacteria out here are kept out there. It doesn't take long for that gut lymph tissue to calm down, and then those inflammatory signals disappear. So let me give you 7 keys to quench inflammation as we wrap this up. Number 1, a fiber-rich diet, as in the 7 systems plan. If you follow my diet, you are on an anti-inflammatory diet. Number 2, increase omega-3, but decrease seed oils. Just increasing omega-3 won't help if you don't cut out the bad oils. I'll talk about that in a minute. Probiotics are helpful, especially Akkermansia Plus from Nutridyne. Sleep, control stress, resistance training, and last but not least is oral hygiene. There's a direct route between bacteria that's in your mouth and getting into the bloodstream if you have gum disease. So you need to treat dental problems and oral hygiene as important. Using these factors together, you can help decrease inflammation tremendously, and we have helped hundreds and hundreds of patients do this. So here's those seed oils: safflower, grape, sunflower, corn, cotton, soybean. All of the reds have inflammatory omega-6 in there, and we don't want that in our body. All processed food is going to be high in those things. So we want to use the orange, the avocado, and olive, and yellows and greens. Those are the oils we want. They're low in omega-6 or linoleic acid. So how do you get started? Well, here's the first thing I want you to know. You don't have to be perfect. You don't have to do everything, but you need to get in a healthy rhythm. You need these habits going, and then you just need to keep doing that. And I want you to know that lifestyle is the most powerful anti-inflammatory, more powerful than these anti-inflammatory drugs, and no side effects. So should you get tested? Well, consider it if you have a family history of heart disease. This is a very good indicator of how things are going. If you have multiple risk factors, autoimmune symptoms, or chronic conditions, is a good test to have done, just so you know your base number. A few final thoughts. HSCRP shows inflammation load. Inflammation load. So we want to know what's that load in your body. If your genes aren't optimal, I don't care. We can still control inflammation and help you live a long and healthy life. Ask your provider if you think you should have the test done. Here's a few action steps. Have this test done to see where you're at. Use these steps, the 7 steps I've mentioned, to lower inflammation. And it all goes back to optimizing the function of each of your 7 systems. And if you want more information or a great course on that, see one of our providers across the nation or check us out at 7systemsplan.com.